Cancer is a complex and multifaceted disease characterized by the uncontrolled growth and division of abnormal cells in the body. These cells can invade nearby tissues, spread to distant parts of the body, and disrupt normal physiological functions. Cancer is not a single disease but a collection of related conditions, each with unique characteristics depending on the cell type, tissue, or organ of origin. Despite advances in medical science, cancer remains a leading cause of morbidity and mortality worldwide. What is cancer? At its core, cancer is a disease of cellular malfunction. Normal cells in the body grow, divide, and die in an orderly manner. When this process is disrupted, cells begin to grow uncontrollably, often forming a mass of tissue called a tumor. Tumors can be classified as benign tumors, non-cancerous growths that do not invade nearby tissues or spread to other parts of the body. While generally not life-threatening, they can cause problems if they press on vital structures. Malignant tumors, cancerous growths that invade nearby tissues and have the potential to spread, metastasize, to distant organs. In some cases, such as leukemia, cancer manifests without the formation of solid tumors, instead involving abnormal cells circulating in the blood or bone marrow. Causes and risk factors. Cancer is caused by genetic mutations or changes in the DNA of cells. These mutations can be inherited, acquired through environmental exposure, or occur spontaneously during cell division. Several factors increase the risk of developing cancer, including genetics. Family history of cancer can predispose individuals to certain types, such as breast, ovarian, or colorectal cancer. Lifestyle choices, smoking, excessive alcohol consumption, a diet high in processed foods, and physical inactivity contribute to cancer risk. Environmental factors, exposure to carcinogens like asbestos, ultraviolet, UV, radiation, and chemicals can trigger mutations leading to cancer. Infections, certain viruses, example human papillomavirus or HPV, hepatitis B and C, and bacteria, example Helicobacter pylori, are associated with specific cancers. Age, the likelihood of developing cancer increases with age due to accumulated genetic mutations over time. Types of cancer. Cancer can originate in virtually any part of the body. The most common types include carcinomas, cancers arising from epithelial cells that line the surfaces of organs. Examples include lung, breast, and skin cancer. Sarcomas, cancers of connective tissues, such as bone, muscle, or fat. Leukemia, blood cancers originating in bone marrow and affecting blood cell production. Lymphomas, cancers of the lymphatic system, including Hodgkin and non-Hodgkin lymphoma. Brain and spinal cord tumors, such as glioblastomas and meningiomas. Symptoms of cancer. The symptoms of cancer vary widely depending on the type and location of the disease. Common signs include unexplained weight loss, persistent fatigue, pain or discomfort in a specific area, lumps or swelling, changes in bowel or bladder habits, persistent cough or difficulty breathing, changes in the skin, such as new moles or changes to existing moles, unusual bleeding or discharge. It is essential to note that many of these symptoms can be caused by conditions other than cancer, but persistent or worsening symptoms should prompt medical evaluation. Diagnosis. Diagnosing cancer involves several steps. Physical examination, doctors look for abnormalities like lumps, swelling, or changes in skin color. Imaging tests, techniques like X-rays, CT scans, MRIs, and PET scans help visualize tumors and assess their size and spread. Biopsy, a sample of tissue is taken and examined under a microscope to confirm the presence of cancer cells. Laboratory tests, blood and urine tests may reveal abnormalities, such as elevated tumor markers. Treatment options. Cancer treatment depends on the type, stage, and overall health of the patient. Common modalities include surgery, Physical removal of the tumor and surrounding tissue. Radiation therapy, using high-energy radiation to kill or shrink cancer cells. Chemotherapy, drugs that kill rapidly dividing cells throughout the body. Immunotherapy, boosting the immune system to recognize and destroy cancer cells. Targeted therapy, drugs that target specific molecules involved in cancer growth. Hormone therapy, for cancers like breast and prostate cancer, which are influenced by hormones. Stem cell transplant, replacing damaged bone marrow with healthy stem cells. Prevention and early detection. While not all cancers are preventable, many steps can reduce the risk. Avoid tobacco and limit alcohol consumption. Maintain a healthy diet rich in fruits, vegetables, and whole grains. Exercise regularly and maintain a healthy weight. Protect skin from excessive sun exposure. Get vaccinated against HPV and hepatitis B. Participate in regular screening tests, such as mammograms, colonoscopies, and pap smears. Early detection significantly improves the chances of successful treatment. Public health campaigns and advances in diagnostic tools play a critical role in identifying cancer at its earliest stages. Conclusion: cancer is a formidable challenge to human health, affecting millions of lives globally. However, ongoing research and advancements in medical technology have improved survival rates and quality of life for many patients. By adopting healthy lifestyle habits, participating in screenings, and supporting research initiatives, individuals and societies can contribute to reducing the burden of this disease.